research actually started off with clinical trials. So currently, I mean, I do consult with clinical trials, but my majority of my career is GME research and academia research and grants and all that stuff. And also got some training from Harvard Medical School. So this slide, so I'm basically a divisional research director for HCA Healthcare within the Houston market. So these are the three hospitals that comes under me for research, and I listed all the residency program that I work with. So we have Kingwood, we have West, we have Corpus Christi, and these are the residency programs at each hospitals, and it also includes a fellowship program as well. So all the residents and fellows and program directors, APD, faculty, core faculty, I oversee all the research work, and everything has to go through me for all of these hospitals and these GME programs. And HCAs is growing, so there'll probably be more programs in the future. You're probably wondering why family medicine is highlighted and bolded in red. No, that's not a mistake. I just want to let you guys know, as of last week, there's an open spot for FM in our program for PGY1. So if anyone who is a U.S. green card holder with good scores, no attempts, feel free to reach out to Shifa or IMI, send your CV because they're looking to replace that open position, and she'll just forward it to me, and then I can forward this to the PD to consider you guys if anyone's interested in family medicine. And as we get more opportunities, I'll touch base with Shifa and IMI, and then she can reach out to you guys. So I want to start with a big overview when we talk about research. If you look on the slide on the left side, so when we talk about IMGs, FMGs, their pathway to residency, so they go through multiple steps, right? So there's exams, there's visa status, there's clinical rotations in there, there's research in there, and then some people end up doing work. So they basically get jobs, and during the whole process, they're waiting to match somewhere. So based on data for the last 5 years or so, about 60% of all applicants will match into a residency program, and about 40% on average will not match, right? So what happens to the 40%? So 40% of those applicants will probably go back into the cycle. Okay, most of them, and then some of them will probably look for alternative pathways. And then we have a lecture on alternative pathways, so I'm not going to really go into it. But this is just a big overview of the whole picture. So these are the common reasons I noted down for IMG, FMG who are interested in working in research with me or just in general. So the most common is, okay, I didn't match, or I went for interview last year and my CV looks good, my ERAS application looks good, but there was something missing. So the PD advised me to get involved in research. So I'm looking for research right now. So that's one thing. Second thing is this gap. Obviously, you should not have a gap in your CV. So if you want to fill those gaps, most likely, you can fill them with clinical rotations, or you can fill them with research. And some candidates, they're studying for this step 3, and they know they'll probably have a couple of months gap. So while they're studying for step 3, they get involved in some type of research activity. Other reasons is you want to strengthen your ERAS application. You want a LOR. Some people, they don't have enough letter recommendation, or they're looking for a university academic letter recommendation. So this will be an opportunity to do that. And then there's also medical student electives. So past couple of years, there's been a trend, especially in the US grad, and not so much in the IMGs, I've noticed. And I'll talk more about that later, where they basically take a year off from medical school just to get involved in research. So I'll talk more about that a little bit later today. And then lastly, people do research because they're like, okay, I need an alternative pathway. This is not working out for me. I need an alternative career. I'm done. So research would be a good opportunity, and someone will discuss that as well. So I know no one. I don't believe anyone brought this up, but this is pretty cool. So I was on the So basically, my entire presentation, all of these data and slides that I'm showing you, is directly on NRMP website. So you guys are more than welcome to take a look at it when you have time. All the data that I have is from 2021, from this year. So this is a cool slide that I came across. It's pretty interactive, and I was having fun playing around with it. So if you look on the right side, right, you can basically pick the special. I just picked internal medicine. So you can basically, put all the criteria that you have, everything that you have done, into this. This is using a Tableau software. So what it does is pretty interactive, and it'll tell you based on your status, or if you are a USIMG, USFMG, or your IMG, like what scores would you need, how many percent of those matched, did not match. So this is a pretty cool thing. I just thought to share with you. This isn't like nothing research related, but it'll be good because you can even put down publication years of research experience. So it'll tell you, like, based on the scores, who matched, who didn't match. And if you put your cursor onto the green and red, it'll give you more information. You can even click on it. So there's a lot of cool stuff. I just wanted to bring this up. Feel free to go onto the NRMP website and take a look at this. Okay, so now for the next 10 minutes, I'm going to show you data, right? Dr. Shahzad Raza, he showed you data. So obviously, you need to know from research side, what does the data show you? That's one thing. So I'm going to show you data. I'm going to show you. So this is survey that NRMP sends out to all the program directors, right? So they send out this survey every year, asking them for different personal characteristics and other knowledge of applicant whom they would consider to interview, and then they will also ask them who would you consider to rank. So on the left, what you'll see is in percentage, and on the right is based on mean. So it's pretty much, I put them side by side, and I'm really not going to talk about everything because someone else will speak about it. I'm just going to talk about research, but this next couple of slides is just general to all PDs. So this is basically all specialty. And on my slide on top, you see the percentage. So for PD survey, right? So overall percentage. So I put down 23.3%. Just keep in the back of your mind, surveys, the mean response rate for survey is about 20 to 25%. So if you get a 20% response for a survey, that is normal. I mean, that's what you're gonna get. But anything above 20 is actually really good. Above 20% is really good. So at least this is not accurate information, I would say, but at least this will give you some idea on the specialty that. Hello. Oh. On the specialty that that you want to apply to. So in this first slide, if you look at the red arrows, I highlighted volunteer experience, which is very important. Dr. Shahzad went over that, but then also highlighted research interest in research. So overall, research interest on the left slide is about 42%. If you look on the slide on the right, it's about 3.6 out of 5, which is not bad. So research is above average, right? So overall, so this is what PD thinks based on the survey response. So, and this is the results whom to interview. On the next slide, so this is the results like during ranking. When you rank, how important is research and volunteer, right? So if you look at research and volunteer, it's still not bad. Volunteer is about 45%, and research is about 30%. And if you look compared to the mean, it's still above average mean. Okay, so I just want to give you a big picture. Remember, application is it's the whole package. So you need to individualize this to whatever you're applying to and to your experience. Okay, so now moving forward, I want to just talk about the 5 core specialty that IMGs, FMG usually apply to. So once again, on top is the response rate in percentage, but I'm not going to talk about volunteer anymore. I'm only going to specifically focus on research moving forward. So for family medicine, as you can see, it's about 10%, which is on the low side. So family medicine really don't care too much about research. If you have it, it'll be good to talk about it. It'll shine your CV. And then on the mean side is about 2.5. So it's pretty average for family medicine. So this is what data we have that show that who to decide to interview. And then when they decide to rank, it's pretty much the same thing. So it's on the lower side, about 7% and 2.9. So it's pretty average. So family medicine, if you're applying for family medicine, like you'll know, okay, is research important, not important? Should I do it? Should I not do it? So this is something you need to consider based on everything else that you have on your application. Moving on to internal medicine, which is a little bit of our favorite. So internal medicine, when we talk about research, right, for last year's data, it's about 30%. So 30%, which is about 3.4 in the mean. So it's pretty above average. So if you have research, they'll consider you. It's actually a plus point for interview. It's not that bad of a data from last year. But then also remember, since last year, there's more publications. Since last year, there's more research going on in the scientific community with residents, medical students, because of COVID. Anything you publish about COVID will be, anything you write up about COVID will be published, and publication fees has been waived. So there's a lot of research happening because there's nothing else going on, right? So everyone's involved in research. So it's kind of the data may be skewed because of uptake in research activity within the past year, but at least you'll have some idea here. So for this internal medicine, this is for ranking. So for ranking, it's not bad. It's still about 28%, which is 3.5 mean out of 5. So that's how important research is for internal medicine. Now, for those who are applying for OB, look at the OB response rate, right? It's 32%. So the response rate for OB is pretty good, better than other specialties here. And if you look at OB, right, OB has 57% of if you have research interest, you're more likely to get an interview in OB, which is 3.6 out of 5. But then when they rank you, it drops down to like 31.5. So it just means like you probably will get the interview, but then you have to use your interview skills and try to impress them, and try to basically sell yourself like this is why you're worth it. So interest in research is 31.5, which is 3.6 out of 5. Pediatrics. So in pediatrics, the response rate is 25%. Which is okay. So interest in research is 21.7. It's like almost 22%, not bad, and it's pretty average, 2.7 out of 5 in deciding who to interview. And it drops a little bit when it comes to ranking. It goes down to like 17%, 3.3, which is pretty common for pediatrics. So now moving on to psychiatry. Psychiatry response rate is almost 25%. Psychiatry involved in research actually went up from last year. It's like 30% now, and which is 3.2 out of 5. And when they consider for ranking, it's not bad either. It's 26%, which is 3.6 out of 5. So this is the data that we have. And surgery, look at surgery. Like maybe everyone should just apply for surgery if you have research experience. So surgery is the highest out of all of them. The response rate is 25%, but surgery, if you have research, 63% chance of you getting an interview, which is 3.9 out of 5, which is very good. And for ranking, it's still pretty high, even though it's not as high as interview. For ranking, is 38%, which is for 4 out of 5. So this is data. This is, so you need to figure out what do you want to apply for? What does your CV look like? What this data shows? Where do you fall into this category? What do you need to do? All of that, you guys need to figure it out for yourself. Okay. So we just looked at surgical data, right, for last year, right? So this is a paper that I usually show. This is published from Aga Khan. So they basically looked at all their graduates from 2008 to 2017. And what they did is they looked at everyone who has research experience, compare them with people who have no research experience applying for surgical residency. And what they found is people with research experience have higher success rate, which supports the data we just saw. right? This is an old paper. Next, this is a newer publication. This was published last year. So what this did is this didn't look at Aga Khan. This looked at all of IMG, right? So this basically looked at all IMGs applying for general surgery program from 2015 to 2018, and then what they did is they basically, they were looked at dedicated research time. So what dedicated research time means is, like I was telling you earlier. Um, there's a trend in the past couple of years to take time off from medical school to do research. That's what dedicated research time is. So like, so it means like, a medical student is taking 6 months off or is taking a whole year off to do research. So what this study showed is, yeah, like dedicated research time does have a better outcome for IMGs who are applying for general surgery. But according to most PD that were surveyed, they don't recommend you take time off from school just to do research. If you do it in between, that'll be good. But they don't really advise you to do that. But in general, research, whether it's dedicated time off or whether while you're doing rotations or whatever, if you have publications, if you get involved in research, you have better outcomes in getting a general surgery residency spot. So I want to put that in perspective with medical students from the U.S. So this is a paper published which talked about research gap year, right? So this is the same concept. So like I said, it's very common in the U.S. USMD, USDO program. This is a paper published by a DO program. So it's very common. I've seen a lot of medical students who join us for research and they took dedicated time off, either third year or right before graduation. So they take time off to get involved in research. So what this paper is basically talking about is, like, do they become like, are they better, do they have more publications in peer review? Yes, they do. So that's one of their outcomes they looked at. Another thing is, like, as a resident, when they become, if they take a gap year off and then they match into a program as residents, are they better than those residents who does not have experience with research? Which is true. They are better. But what this study shows is, medical students, U.S. medical students who take a gap year off, they are actually, they do produce more during residency, but they usually are not the first author or the second author. So they kind of laid back and try to help everyone else push their research forward. So this is basically what U.S. medical students are pretty much doing for the last couple. It's becoming a popular thing nowadays. Okay, moving on. So data. So I've showed you some data. So how will research help you for residency, right? So as residents, I deal with residents all day, all night, 7 days a week. So ACGME has a guideline for RRC, which is Resident Review Committee, right? So program directors, they want their residents to be involved in some type of scholarly activity. It is required for graduation. So every program is different, every PD is different, right? So some program, they weigh heavily on scholarly activity. So what is definition of scholarly activity? Is different based on program. So scholarly activity includes like any abstract publication. If you are a reviewer for a journal, that's included in scholarly activity. If you are if you did any quality improvement project or process improvement project in the hospital, if you are part of any hospital committees, those are considered scholarly activity. So if you do any grand rounds or any lecture, which is a full lecture series, if you develop any educational material, the list goes on. If you go to ACGME website, it defines scholarly activity based on the residency program that you're in or that you're planning to go into. So you can get more information in there. So residents are required to participate in scholarly activity. So this is for all. This is for academic programs and for community hospitals as well. Okay, so what sets you apart from average medical school graduate, right? So this is so you have to personalize your CV. You have to personalize everything to what you did, right? So the answer to this varies. Most program directors, they have experience in research. That's why they're the program director. They have to be well-rounded, right? So very rarely you'll find a program director who is clinically strong but have no research experience or no research background. So so especially academia program, they will look highly upon research compared to community programs. But saying that some community PDs, right, if they have good research experience, they will think highly of research. If PDs, don't have good research background or research experience, they probably won't even care too much. So it depends program to program and depends on the faculty and the program director as well. And then like another thing is, if you do research at a good program, good university-based programs, you add that to your CV, you get, a university-based LOR. So this is basically plus points for your career. So this slide is basically talks about what will your research experience tell the PD. So I mean, it all depends on when you have research experience, right? It's all about how you interview. You have to spin everything into a positive direction, like how it incorporated within your career. How you came about doing it. What did you do? So you have to tell the whole story. So this basically makes you a little bit more competitive for residency, depending on the programs you apply. It shows PD you have analytical and time management skills. And also one thing you can bring up is because a lot of residents, they don't really get involved in research. So right now programs are having a hard time getting residents involved in research and getting them to complete a research project prior to graduation. So usually, from my experience, is they'll usually, they usually get like one or two residents who either have a PhD, master's, MPH, MHA, someone who has research experience. They will usually take a couple of residents who have research experience. Why would they do that? Because they can encourage other residents to participate in research programs. So that's common. Every class will have a couple of residents who basically know research. They know how to do everything, and they're the one who will encourage the other residents to participate, and collaborate with. So this is important as well. So if research is done in the right manner, right, it adds experience. You have publications, you get a LOR, another opportunity for you to, you communicate with, attending core faculty. Maybe you can get an observership, clinical observership out of it. It adds big names to an institution. Like you have U.S. experience as well, and makes you stand out a little bit among other applicants. But like I said, like everyone's doing research for the past, at least for the past year and a half. So you have to decide for yourself where you stand, and you have to make the whole story. So moving on to another avenue. So talking about research, how do I start, right? So I mean, I don't have time to go through all of that, but I just want to share this slide with you and share some experience and some stories with you guys. I only have 8 minutes left, so I'll rush through this. So a lot of residents, faculty, and fellows, right? Like they don't know how to come up with research questions. So I've listed a whole bunch of stuff here to help you come up with research question. So the first thing to start with research is, right, coming up with a good research question, and you need to have a good mentor who can help you move your research forward to publication. So the one thing I listed is journal club. So let me go through this example. So I was invited to a journal club for a cardiology fellowship last week, and this is the article that they were discussing, earlier delayed cardioversion and recent onset AFib. So while they were discussing this article, the whole outcome of this article, they wanted to see if early or delayed cardioversion make a difference in bringing these patients back to sinus rhythm for 4 weeks post follow-up. So what this clinical trial showed is there's no difference. So I was thinking about the journal club. It stuck to my head overnight, and I was like, "There's no difference." So what I did the next day, I did a quick literature review search, right? So when I did a quick literature review search, I came across a couple of clinical trials, and some say early is better, some say delayed is better, some say there's no difference. So there's no really a guidance, right? What is better, what is not better. But this is a good topic to have. So what I did is, so I'm going to use this article. So what I did is I went to the expert. I'm not a cardiologist, right? So I went to the cardiologist fellow. ago, I went to cardiology program director. I was like, hey, you're the expert in this field. Here's a paper. There's no real answer to this from my quick literature review. Can I convert this into a research question and do it retrospectively? I don't have time to do clinical trial. And they all agreed, they all agree we can do this study retrospectively and validate some of the data. So this is how I just got a research question, and I'm the PI on this study, and then we are going to move forward with this study. So this is just an example how Journal Club can help you, make you think in the right direction. Other things is you can do literature search yourself, which is time consuming. If you have a topic of interest, do a literature review, see where the gap is, see what you can do, what you cannot do, and come up with research questions. The third thing is if you go to research presentations at meetings and stuff like that, you'll see people discussing ideas, right, about research projects. Oh, this is a great idea. I would do it this way. I would do it that way. So whenever people have a discussion of research ideas, if you hear anything that's interesting, note it down. They're whatever they're talking about, it becomes your research idea, and then you can just go ahead and move on from there. Next thing is limitation and future direction. If you look at publication articles, manuscripts, they always talk about, hey, this is the outcome of my research. In the future, I would like to do this, right? So whatever they want to do in the future, that becomes your research question, and then you basically do that for them, because most likely if they have a future direction and they're not a researcher, most likely they're not going to continue with the paper. Setting benchmark from previous research. So like how recommendation changes. So something that was validated 10 years ago, 8 to 10 years ago, may not be true today. Guideline changes, every couple of years. So if there was a guidelines that was like 5 years ago, you can grab the same research project, validate that today, and that is setting benchmark. So your research question is, this is the guideline that was that we followed 5 years ago. Today, since things are changing, everything is changing, my research question is, I just want to validate if this is true today. So that is setting benchmark. And then the last thing is daily clinical experience. So working in a clinical environment, residents and fellows and medical students, they always get frustrated. There's something that frustrates them, right? So what I tell them is like, so they either get frustrated by the processes. Why are we doing it this way? There must be a better way. Or they get frustrated with the treatment or with medications or whatever the processes they have. Maybe they have experience in medical school back home. Hey, we treat this differently. Why do you treat it this way? So any frustrations you have as residents or medical students or fellows or even attendings, those frustrations get converted into either QI projects, or you can convert them into research questions. So this is basically, I give you a whole bunch of things to think about, how to come up with research questions, and then make sure you have a mentor, someone that can basically help you, guide you, move your project forward. You don't want to waste your time. So this is a publication. This I think was published a couple of years ago. So this is basically a publication. This is a systematic review talking about, interventions, like how can I increase my research publication for those who are interested, right? So the outcome, the main point of this study is, in order for you to publish, in order for you to increase your research publication, you need good leadership. Leadership meaning you need a good mentor who's dedicated. You need a research director, research support. So if you have those things, you're most likely to get publications. You most likely move your project forward to completion. Because I hate it, if you're going to end up wasting your time. A lot of medical students do that. So I just want to share this one story with you. Do I have time? Yes, I have time. So I just want to share this one quick story with you. So this is a project I'm working on right now. So this is an idea I got just by talking. I was talking to an ED pediatric PD program director, and we talked about, and he was just talking about intractable headache in pediatrics ED, and then he was just mentioning this, there's really no guidelines for intractable headache, but for adults there's guidelines. So and then we were talking about compazine and Reglan, right? So in adults, compazine is the drug of choice for intractable headache, but in pediatrics, there's no guidelines. Both of these drugs work in pediatrics, but there's no there hasn't been a study that showed one is better than the other. So what I did, I grabbed that research, I wrote up a grant which I'm applying for. Now what I need to do is I need to do this retrospectively to have some baseline data, have a pilot data for me to do a randomized control trial. So this is a study that I'm doing currently. I'm the PI of, and then all of those are residents and research coordinator that I added. So this is just to show you, talk to people. You'll always come up with ideas. There's always projects out there that you can tag along with. And lastly, I want to finish off what IMI has. So IMI has gives a lot of research support. They have research seminars, which is conducted in New Jersey, right? So I'm part of the faculty there. So I basically give lectures. We have lectures on how to develop research questions, how do you develop your study hypothesis. So all of this stuff, study design, how to develop a poster. So there's like a whole seminar on this. It's like a one-day seminar, and at the end you get a certificate of completion from IMI. So this opportunity is here, with working with us here. And then we also have a journal for you guys, right? So this Journal of Medics Internationals. There's a lot of journals out there that you can publish probably for free, but we also have our own journal. So it'll be good if you can, submit your projects to our journal here. It's at no cost, right? This is the website at the bottom. You can click on the website and get more information. So there's opportunity to publish within IMI as well, and you can add this to your CV also. This is I worked on this. So this is vitamin C for sepsis and septic shock. So I did a systematic review. This is like 4 or 5 years ago. I did a systematic review. All the authors on this are actually medical students who came to our seminar at IMI New Jersey. So basically, I worked with all the students, and then we submitted this to the Journal of Medics International. So like with IMI, we submitted this and it got accepted, and it's published. So now what I'm doing, we have more information now. So I'm reviving this study. I'm going to add more to this and resubmit it as a systematic review. And lastly, I'm done with time, thank God, but I want to leave you with this, a quote from Imam Ali Islam. Everything diminished when it is used except knowledge.